thank you very much. And I just want to say it really is an honor and a great pleasure to be here. And also listening to all the introductions and all the things that are happening here, it is why I came back to Delaware. This is really an incredible talent bed, and there are just wonderful, wonderful opportunities. I also have to tell you that when I was in Arizona, we put together a town hall report on bioscience and biotechnology and how to roll that out to communities. And we did a town hall at the Grand Canyon. And as we were researching the area, and this was probably maybe 9 or 10 years ago, as we were researching the area, and I had my students in the office doing this, they brought information to me and said, here's where the greatest places are and what they're doing and what's innovative. And guess what came up high on that radar screen? It was DBI. It was the biotech park. It was all the things that you're doing here. And so it really is quite a pleasure to be here and talk with all of you. I just have a brief time this morning to tell you about the Delaware Health Science Alliance. And so what I want to do this morning in my comments is to actually give you an overview of the Alliance, how we are trying to move that forward in a very accelerated fashion, what the various pillars are that I think will form the strength of that. The reason that I think it's quite important to do this, and you'll see this as I make the presentation, is what we need to do is connect in a much stronger and more significant way to bioindustry and to biotechnology. And so I'm really hoping that this will really be the beginning of many conversations with all of you in terms of how we interface this community with what we're trying to do in terms of moving the Alliance forward. So the first part of the talk then will be giving you this overview. I'll give you some snapshots of some of the things that are happening in the Alliance. But then also the second part of the talk will then be moving into how do you take a structure that is really very virtual and connecting people and places, and then take that to a place that then becomes real. And that will be the Chrysler site. And so I want to talk to you a little bit about what we'll be doing on the Chrysler site, but have you understand as well that this is one person's vision of what we might do. It is a continually evolving this vision, and you'll see that, and there's incredible opportunities for people to be engaged and involved in that. Now, before I move on to talk about the Alliance, I just want to take a moment to talk about the college, because I am also the Dean of Health Sciences. And Health Sciences at the University of Delaware has been evolving over the years. It began as a college of nursing, but now includes all of the health professions. And the various units that you see here are all of the units that are included in the college. But then the ones that you see at the bottom, if you can see those: public health, occupational health, pharmacy, medical students. These are all things that we do in partnership with TJU, or Thomas Jefferson University, and that partnership is continuing to grow. The other thing that I want to point out is we are rapidly growing the college. There was a huge ad in the Chronicle of Higher Education that just came out a couple weeks ago in their big issue. We are searching for 9 faculty members, and significant in this is a Unidel chair in health sciences, a new director for our School of Nursing, and also chair of kinesiology and applied physiology, and then we're doing cluster hires in all of our areas. I bring this to your attention because all of you are connected, you're working throughout the country. If there are great people that you work with somewhere else in the country and you'd love to get them right here, then this is an opportunity. Let them know about what these hires are, and let's attract them to come here, because there really are, as you all know, incredible opportunities to partner and do things together. And my experiences in the past, we have done joint hires with industry, we've done joint hires with clinical groups, and they turn into just amazing abilities to collaborate. So here's a picture of the Alliance. I think most of you are familiar with it. The 2 academic partners in the Alliance are the University of Delaware, of course, and Thomas Jefferson University. and to medical school. And then our clinical partners are Christiana Care Health Systems, and Nemours AI DuPont Children's Hospital. So what this partnership then allows us to do is continue to develop academic programs that then can roll out, the students get their experiences at these clinical sites, but it really creates this framework to build biomedical research. At the same time, you are training the next generation of healthcare leaders. You can't beat that combination. Now, why is this so important? And again, it probably goes without saying to everybody in this room, because I'm sure you understand this pipeline. So the pipeline that goes from discovery to delivery, and the bottom line is, what is the impact on patients? And so if you look through the history of science, this pipeline takes way too long. From the beginning of the time in which things are discovered in a laboratory, if you look at the history of the development of vaccines or antibiotics, it's 20, it's 30, it's 40, it's 50 years. Many of us are impatient. We want to accelerate that pipeline. How do you do it? The best way to do it is through partnerships. So the Delaware Health Science Alliance is actually setting up mechanisms to do this, but we need, one of the critical pieces here is this last piece. How do you take what has been scientifically tested in the laboratory and then translate that to something that is going to deliver and have an impact on patients? And so I'll go through sort of a number of these things, but really talking about how we can partner together to enhance translational research. And so again, the other type of research that we are talking about is not research that is done by one scientist in their laboratory, but it is done by engineers, it's done by biochemists, it's done by biologists, it's done by physicists, it's done by chemists, and also partnering with people in the biotech community who actually know how to do that next stage, which is translating that into a drug or an intervention or a new orthotic and prosthetic. But what it means from the university level is that we've got to come out of our silos, which is rapidly happening and has been happening for quite a while at University of Delaware. So we have a bioengineering department that's emerging. All of our colleges have interdisciplinary programs that cross. We have a biomes program in our college, which involves bioengineers, movement scientists, exercise physiologists, all working together on grand challenges and grand problems. So when you have this group working together, this enables you to come up with integrated analyses and also allows you to work in this area of prevention, which of course is extremely important if we're going to be able to cut healthcare costs. In addition, of course, the translational piece is really being able to go bench to bedside and back and forth again. When I originally started in this area, coming as a benchtop scientist to this, I always started as the benchtop and then carrying it out to clinical. And I quickly came to realize, of course, that the real questions and issues are raised at the patient bedside. And so having students do internships in hospitals and undergraduates involved in research in areas and being able to bring those questions into the laboratory, work on solutions for that, then roll these out into testing in the clinical areas, and then finally being able to roll this into practice, but it doesn't get rolled into practice unless you can couple that as well with health policy. So this also shows you the importance of keeping academic institutions into this loop as well, because we can provide all of these various pieces along this pipeline to be able to enable these things to move out and become real.